A 52-year-old man sits across from a neurologist, unable to walk even a tenth of a mile without his legs giving out. His shoulders and hips have grown visibly thinner. His tongue looks shrunken and trembles on its own, and across his chest tissue that should not be there has started to grow. For the past year, doctors have been fighting this with everything they have: steroids, immune-suppressing drugs. And when those failed, they tried extreme measures: an antibody infusion, a second immune-suppressing drug, and a procedure where his blood was removed from his body, filtered, and put back in. None of it worked. Not one, but 2 rounds of powerful treatment for a supposed immune disease, but his muscles kept getting weaker and symptoms were getting worse. But in order to solve this case, you have to look a little deeper than just the immune system. By the end of this story, you will understand how a decade of a disease gave way to a diagnosis written directly into this man's genetic code, one that had likely been there since before he was born. Hey, how's it going? This is Mendel Science. Please like and subscribe. Now let's get into it. The backstory. Let's go back 10 years. At that point, this man began noticing something small: a mild weakness in both hands, along with a faint tremor whenever he tried to use them for anything precise. It was subtle enough that he did not think it was worth a doctor's visit. Life went on. 4 years after that, things shifted again. Stairs became harder to climb. The weakness in his hands and the tremor along with it continued to worsen, slowly, over years rather than weeks or months. For 9 full years, that was essentially the whole picture. No numbness, no tingling, no problems with bladder or bowel control. His weakness never came and went. It simply crept forward, at a pace slow enough that he could still work, still function, still live his life. Because none of it stopped him from doing what he needed to do day to day, he never sought medical care for it. Symptoms begin to appear. Then about a year ago, his legs began to fail him in a way his hands never had. His walking tolerance dropped sharply, down to less than a tenth of a mile before his legs simply would not carry him any further. This time he went to a hospital. Blood tests revealed a striking finding. Creatine kinase, an enzyme that leaks out of damaged muscle, was not just elevated, it was measured at levels between roughly 800 and 2,300, when a healthy result should sit under 308. His liver enzymes were also mildly elevated, though that can simply be a side effect of muscle damage rather than a liver problem on its own. Doctors scanned his spine, normal. They scanned his brain, normal. They performed a nerve conduction study, which suggested demyelination, along with some degree of nerve involvement affecting both sensation and movement. They took a biopsy from the muscle of his thigh. The biopsy showed nothing specific. So far, there was no clear answer for this man's illness. With persistent, unexplained muscle weakness, a dramatically elevated CK, and inconclusive nerve findings, doctors landed on a diagnosis: polymyositis. Polymyositis is an autoimmune disease where the body's own immune cells attack muscle tissue, combined with a nerve condition called CIDP, where the immune system damages the protective coating around nerves. Believing they were dealing with his immune system attacking his own body, doctors started him on a daily steroid treatment meant to shut that response down, as well as 2 other immune-suppressing medications. He stayed on this combination for months. For a little while, he seemed to get better. Then the improvement stopped, and the weakness kept advancing anyway. His CK levels never came down. Because he was not responding the way a genuine case of polymyositis should, he was referred onward to a specialized hospital for further evaluation. There, a closer neurological exam picked up on details that had not been fully appreciated before. In his shoulders and hips, he could still move against resistance, but noticeably weaker than normal. In his lower body, he could lift his own legs against gravity, but not much more than that. His hands and feet, by contrast, tested essentially normal, so whatever this was, it was picking its targets carefully. His reflexes were diminished almost everywhere they were checked, and critically, none of the reflex signs that typically point toward damage higher up in the brain itself, the kind seen in a disease like ALS, were present. His tongue had visibly atrophied and trembled on its own. And there was that unexplained chest tissue growth, gynecomastia, something polymyositis does not typically cause. Blood tests for testosterone and related hormones came back completely normal, which only deepened the mystery. If his hormone levels were fine, why was his body growing new tissue on the chest at all? Even so, the path forward was still not obvious. ALS, myasthenia gravis, and a primary muscle disease were all still on the table. Doctors ran a broader immune panel. It came back negative across the board, no antibodies pointing toward any classic autoimmune muscle disease. And yet, in the middle of all this uncertainty, before anyone had a definitive answer, he was started on an even more aggressive course of treatment. A powerful antibody infusion, another immune-suppressing drug, and a process where his blood was drawn out of his body, run through a machine to filter out immune components and returned to him called plasmapheresis. Again, nothing changed. 2 separate rounds of serious immune-suppressing treatment, and his body simply continued the same slow decline it had been on for a decade. Even the genetic testing very nearly missed it. An initial genetic panel came back uninformative because it had only been designed to catch single-point mutations, tiny one-letter typos in the genetic code. It was never built to detect the kind of mutation this man actually had, one where a whole sequence repeats itself far more times than it should. The diagnosis. The real turning point came from the nerve and muscle electrical testing. Rather than showing the pattern doctors expect from an immune attack on muscle tissue, his results showed something different: chronic nerve damage, with reduced or completely absent sensory signals in his limbs. This pointed toward a problem with the nerve cells themselves, not an immune assault on his muscles. Combined with the tongue atrophy, the shoulder and hip weakness, the weakened but not overactive reflexes, and the gynecomastia, one specific and rare diagnosis rose to the top of the list: Kennedy disease, also called spinal and bulbar muscular atrophy. 2 other possibilities had to be argued away first. Myasthenia gravis usually causes weakness that comes and goes throughout the day, along with reflexes that stay normal or even brisk. His weakness did neither of those things. ALS was the harder call, since it shares a similar age of onset and several overlapping symptoms. But ALS almost always involves damage reaching up into the brain itself, which shows up as overactive reflexes and specific warning signs on exam. This man showed the opposite: reflexes that were weak, not strong, and none of those warning signs anywhere. ALS also does not cause breast tissue to grow. To confirm it, doctors sent a sample of his DNA for a very specific kind of genetic analysis, one built to detect repeated sequences rather than single-letter changes. Deep inside a gene called the androgen receptor gene, there is a short stretch of DNA where one 3-letter sequence, CAG, repeats itself over and over, like a stutter written into the code. Most people carry this stutter somewhere between 11 and 36 times. This man's DNA repeated it 51 times. That repeat was the entire explanation needed. The androgen receptor is a protein that nerve and muscle cells use to respond to testosterone. When the gene that builds it contains too many of these repeats, the resulting protein becomes toxic. It builds up inside motor neurons, the very cells responsible for telling muscles to move, in his spinal cord and in his brainstem, and it slowly kills them off. That explains the weakness in his limbs, and it explains the atrophy in his tongue, since the brainstem also controls the tongue and throat. At the same time, this same broken receptor makes the body partially resistant to its own testosterone, even when blood tests show normal hormone levels. That resistance is what had quietly been growing tissue on his chest the entire time. One mutation, one gene, every single symptom explained. The disease is passed down on the X chromosome. Men get one X chromosome from their mom and one Y chromosome from their dad. Women get one X chromosome from their mom and one from their dad. This means women have 2 X chromosomes, while men have 1. Since men only get 1 X chromosome, if there are genetic issues in that X chromosome, then they will manifest, which is part of why it overwhelmingly affects men. Treatment and the road ahead. Once Kennedy disease was confirmed, the immune-suppressing drugs were finally stopped. There was no longer any reason to keep his immune system suppressed, since it had never been the problem in the first place. Here is the harder truth. Unlike some rare diseases, there is currently no treatment that changes the course of Kennedy disease itself. Hormone-lowering drugs have been tested in clinical trials for this condition, and none have meaningfully improved muscle strength or swallowing function. What remains is a supportive approach, neurology follow-up, physical rehabilitation, and monitoring for any future breathing or swallowing difficulties, since bulbar weakness can eventually affect both. At his 6-month follow-up, his leg weakness had progressed slightly further, but he remained functionally stable, still able to manage his day-to-day life. For now, the disease is advancing slowly, the same way it had for the past decade, just without the added weight of medications that were never going to help him in the first place. Closing remarks. What stands out most about this case is not the rarity of the diagnosis, but how long the wrong one was allowed to stand. For nearly 10 years, a slowly progressing genetic disease wore the mask of an autoimmune illness, and even after 2 separate rounds of aggressive immune-suppressing treatment failed to help him. The correct path forward still was not obvious right away. Sometimes the most important clue in medicine is not a new symptom appearing. It is an old treatment simply refusing to work. This was not even the first time a case like this has been reported. Other patients with this same disease have gone undiagnosed for a decade or more, treated the whole time for polymyositis, before something like gynecomastia or tongue atrophy finally pointed someone in the right direction. It is rare enough that most doctors will never see it in their career, and it keeps slipping past the ones who do. Somewhere in a single overgrown stretch of this man's DNA, a 3-letter sequence repeated itself just enough times to produce profound issues and a mystery diagnosis. It never needed treatment with steroids or antibodies at all. It needed to be read correctly, one repeat at a time. This is Mendel's science. When the body is a mystery, read the genes. Subscribe and like for more genetic mysteries.